Brought to you by GTA. We start with you.
Health Oversight Chair Senator Therese Terlaje says she understands the deference, but it's staggering.
To me, the earlier they know and the more they know what we're really looking at, and it's staggering. I think that's the only word I can use to describe it. It's, despite, the conditions, it's still staggering.
The report is currently being finalized by the Department of Interior and is expected to be released by the end of March. Senator Terlaje was not allowed to receive a copy of the assessment, and based off a look of the draft, Senator Terlaje tells KUAM it is consistent with the Army Corps of Engineers outbriefing they presented nearly 2 months ago.
They said we need to be prepared to stand this hospital up at a minimum 7 years while we either construct a new one or do the major reconstruction of the existing facility.
7 years to ensure the vital, crucial repairs are made. Senator Turlock says the Army Corps of Engineers confirmed the serious problems include the roof, the HVAC system, the outlived electrical panel, and the most urgent matter, the outdated EMS system that's needed to maintain CMS accreditation. According to Senator Terlaje, preliminary reviews estimated the entire hospital repairs to cost over $700 million.
So it's something that I think we're going to really have to work together to address. But in the interim, even the interim price is so staggering. It's $21 million at least. So that's just to keep us in line with CMS, make sure we don't lose our accreditation.
In order to allocate the $21 million interim cost, Senator Terlaje has introduced Bill 294 for $11 million to come from fiscal year 2021 revenues.
Before we allocate one dime anywhere in this budget, we need to make sure the hospital is included. Now, if you looked at the executive budget request for the FY 2021, it's not in there. There's no capital improvements in there, and in fact, the hospital's operating budget was reduced compared to this year's budget.
As we've reported, Senator Terlaje's bill for $10 million from 2019 excess revenues to make sure the hospital's immediate needs are addressed for the next 7 years was unanimously passed by all the senators. However, Guam's Magahaga has put a halt on the law as Governor Lou Leon Guerrero wrote to the legislature that she has asked the Guam Economic Development Authority to consider finance options first.
If we get the 10, plus the 11, it's going to go a long ways, I think, if we can get it quick enough to make the repairs before we have another, or something goes wrong.
Rather than having a last-minute fight, Senator Terlaje says the amount should be incorporated first into the budget, in advance of any budget deliberations that are expected to begin in the coming months. Reporting for Guam's News Network, I'm Adriana Cotero.
Brought to you by GTA. We start with you.